we're going to talk about pelvic restoration and disease prevention for all women and all Braveheart beauties on this planet. I am Serena, and I'm hosting and teaching this course along with Sharon, Lorraine, and I have two beautiful young ladies here, Alicia and Simran, who are both taking the course, and they have mentioned to Daryl that they would love to also teach this course. So they are coming on board to learn and then to share with you Braveheart women out there what this course is all about. I just want to fill in what this course is about. It's about disease prevention and pelvic restoration. And we cover, if you ever have any pelvic inflammation, disease, prolapses, incontinence, painful sex, vaginismus, cesarean, childbirth, menstrual pain before and after enduring bloatingness, menopausal symptoms, menopause. Menopause means pause the man. Why? We can continue to have our men. We don't have to pause the men, but we need to know how to prevent ourselves from menopausal symptoms. And there are many, many other diseases out there that the medical system have labeled diseases, but we know, and we have all experienced amongst ourselves, how we heal ourselves from many of these ailments. And if you have any other questions out there, Braveheart women, any diseases you want us to talk about, we won't have much time to talk about it today, but we will talk more about it in the course. But if you have questions about the course, what you will learn, what you will get out of it, feel free to ask us. In the meantime, I'm going to put this mic, pass it over to Sharon, who started this Braveheart women with a couple other ladies. I think Lorraine was there, Sam, and a couple other women who were there. So we have these two original ladies from the Braveheart Women Circle, and now we're going to expand this Braveheart Circle to more young ladies, to these beautiful young girls, and hopefully we'll get more to come on board to share their personal experience and their learning and whatever they can with us in this Braveheart Nation. Sharon?
So it's so wonderful to be back in the Braveheart Women's Circle, and that's what we're going to be doing in this. That's what we're going to be teaching within this beautiful pelvic restoration course. It is about the sacred temple. And the pelvic restoration and dis-ease prevention is all about taking those labels that we have been inundated with, vaginosis, vaginitis, all of these things that, painful lovemaking, all of the prolapsing, incontinence, like 47% of the women have incontinence that are over the age of 50. And so what we're doing here by expanding this beautiful circle and bringing in all these wonderful Braveheart women is that we're taking this, and as you can see, it's generational. These issues are generational because of the fact that we have not honored, respect, and loved ourselves unconditionally. And this has been a suppression that has been going on for years and years and years. So it's time now to find our sparkle. It's time now, how would you like to no longer be concerned about painful periods, no longer be concerned about endometriosis, no longer have a concern about ovarian cysts and menopausal issues, prolapsing, all of these issues, libido. It is all about that most sacred region, and it's about stimulating it, it's about revitalizing it on all kinds of levels, connecting ourselves emotionally, physically, and mentally to the fact that this is our most sacred region. And this is about empowerment. And as we move through this, because of the fact that it is about the women, and it is about the women in their empowerment, because that empowerment was destroyed centuries ago. It was destroyed by starting to create lines in regards to men and women. And it's not just about the women, because as we start rising up in the virtues of the divine feminine, the virtues of empathy, kindness, and caring, then now the men will need to rise up, because they will not be able to have relationships with women that do not honor, respect, and love themselves. And Simran, why don't you tell us about the fact that you know, how you are maneuvering through this perfect
Well,
day
let me just-
lifestyle.
Yeah, go ahead.
And about your generation and what you're finding.
What I'm finding in recently starting the perfect day is I've become a lot more energetic than I used to be in terms of eating more fresh and raw, and I'm trying to practice the squats every day and the stretches every day. And I was on birth control for 5 years straight, and I came off of it about a year and a half ago, and I'm basically trying to clean up my body and detox all of that 5 years of taking it was doing to me. So I'm still in the process, and I feel like I should be seeing more right now, but it was a long time, so I need to be patient with that and just keep doing the perfect day and practicing and eating healthy and thinking healthy and drinking healthy, and I will restore
I have
everything.
a question for you, Simran. Why are you taking this course? Why do you think you? Yeah. Sorry. Why are we taking this course?
I'm taking this course because I recently have gotten more into ever since taking the whole life coach and the non-surgical and learning more about how everything I could be doing more to help myself. I've always had an interest in it, but I never really knew how to. So now that I know how to, I'm all in, and I want to learn everything and just improve my overall health now while I'm young,
Fantastic.
so that when I'm older, I'm just even better.
Fantastic. We just finished a whole 2-hour talk with Daryl on the gut-brain connection, and as he always says, issues in the tissue start from the pelvis. Everything comes from the pelvis. Your gut, your digestion tract is where all the issues start to begin. What enters here ends here, and if it does not get digested, we will start to have problems. But I have, Simran has just mentioned that she's taken the birth control pills. My daughter did it without my permission. She did it behind my back. She knew I was against it because I never taken it. But let me just read this very important thing which I read this morning to the ladies. The womb. Our womb is the place where everything begins, because the womb is the beginning. It is dark, it is wet. New life begins in the womb, but not only for babies, also for dreams, for ideas, for creativity, and for the future. So every woman who has a womb can really give birth to the future. Whatever your future is, whatever you want your future to be, we are possible, and we can, once we connect ourselves with our womb and look into ourselves to heal ourselves with love, personal love, self-love. And I have this beautiful Alicia, who is another young lady who's here to do the course. Alicia, why are you doing this course? What would you like to gain from this course?
Well, as I got my mic here,
Todd?
the reason that I'm taking the course is I've had a child and I noticed a change in my pelvic floor. I started doing the pelvic squats and all of the exercises that Daryl recommends, and I've noticed huge improvement. I know there's some areas I could still continue to work on. So I'm excited about learning to unleash my divine feminine power and really connect to myself so that I can share that light with others, and to just let other young women know that, you know, you have the power to restore your pelvic health. There's so many women that suffer from PMS. I used to have really bad PMS before I started on the perfect day, and I've noticed it just get better and better. That I don't even bloat anymore.
Fantastic.
So it's
Brilliant.
amazing. So your period doesn't have to be inconvenient and painful. You can restore the natural health, and you won't have the issues that are considered normal, which they're not normal, they're just common, right? Mm-hmm. Common is not normal. Mm-hmm. And I'm in the course to just take what I've already learned one step further.
Yeah, it was so refreshing. I was speaking to Piper, who was in the course, and she's only 20 years old. I'm 65. I wish I knew this before when I was 20. Anyway, she used to hate her period, not like her menses before it comes. Now, since she's done the perfect day and following the protocol, she looks forward to it because it comes and it goes without any pain or stress. But she knows that it's doing good things for her body. It's rejuvenating and replenishing and regenerating the cells in the body. So it's a beautiful thing. Now, on my right, we have Lorraine, who's a 3, 4, 5 timer of the whole life course and a master practitioner. She has some stories to share with us. Lorraine?
Okay, so when I was 18, I was diagnosed with ovarian cysts, one on the right, one on the left. And my periods had been so extreme before that, like, it was horrible. And I did not like having a period because I was just so long and uncomfortable and full force. So anyhow, so ovarian cysts at 18. They removed one ovary, left me with a trace of the other one, told me I would never have kids. My periods after that were still horrendous. I was anemic, and they did an ablation to see if that would help. And it wasn't, that didn't make much of a difference, and they did a D&C. And by this time, I was married, and I wasn't on birth control because I wasn't supposed to have kids anyways. And I got pregnant.
Wow.
I know. A miracle. My daughter was born. She was a big baby, 10, 5 and a half.
Wow.
They ended up using forceps. I had an episiotomy. I remember asking the doctor how many stitches they gave me, and he said, "You don't want to know." So, and then after that, I remember talking to my mom and saying, you know, it doesn't feel right down there anymore. It kind of feels like things have dropped. And she said, impossible, impossible. And sex from there on in was not comfortable. It hurt every single time. So definitely something had happened. 4 years later, I was pregnant again. And when I went in for the first appointment with the doctor, they found that I had another ovarian cyst. So they did a few ultrasounds while I was carrying my son. Immediately after he was born, I had that cyst removed and the rest of the ovary removed. My periods still were horrendous. And I hated that time of month. It just was not very nice. By the time I was late 30s, I was working with a naturopath. And we did a lot of natural things, a lot of the, homeopathics, and a little bit of diet change, but no change up here, and no one ever asked whether I was constipated or not. And I mean, I didn't think I was going for sure once a day. But anyhow, when I was 40, the naturopath that I was working with said, Lorraine, there's no other alternative. You have to have a hysterectomy. So now they're going in for a third time, same, hip to hip surgery, and I got pretty much everything removed. And when I look at what can be done, like none of this has to happen.
Yeah.
I went into menopause pretty much when I was late 30s. And it was, again, horrendous. My hormones were all over the place, right? The doctor who did the hysterectomy wanted me to go on hormone replacement. I was on it probably for about a week, and I wasn't holding anything down. And my mom had had breast cancer, and there was a link between hormone replacement and breast cancer. At that time, that's what they were talking about. So I told him I didn't want to be on this. Is there something else we could do? And he basically looked at me, if you're not going to stay on it, Lorraine, I don't want to see you ever again. And I thought, okay. So I went off it, and I really started looking at alternatives and what I could do, and just changing a little bit in my diet made a huge difference. And I didn't know Dr. Wolf back then. I'm 65 years old, and I feel like I'm 30.
How old were you when you had your first ovary removed?
I was 18.
And then the next one?
I was 29.
And then you had a hysterectomy at?
40.
So ladies, we can prevent all this. You can prevent it by taking action, putting action into reality. Take this course, learn how to prevent yourself. You could be 18, you could be 85, you could be 88. It helps every woman walking on this planet.
Can I just say something?
Sure, go ahead.
Serena mentioned about your what did you say, your soul connection?
Yeah.
Yeah. I remember thinking that I lost my soul. I had lost that deep intuition that I used to have. And I couldn't put a finger on it when that happened. But obviously, when everything gets removed, that's going. But the thing is, my body has memory, and it remembers the energy. The energy is going to be pulled from somewhere else. It's not like that intuition is the only place it's going to come from is the womb. No, but I had to do a lot of cleaning my body, like detoxifying. I also went through cancer when I was 36. Like I just had everything in the book as far as I could see. I had it. As far as a woman, any operation that a woman could have.
Yeah.
And here I am.
Well, and the ovaries are directly connected to the breasts. And when you're talking about the essence of still feeling that you have that spirit within you, is that when they remove the organs, they don't remove the nerve. So as far as your body's concerned, you still have it. And that sacred womb that is so precious to a woman is our power center. And when that is all removed, then that's when the power center starts to dim. And that's now you even have to even try to offset that even more and more because you don't have that anymore. And so the sparkle, and to get the sparkle back is a little bit more challenging. But everybody can have that sparkle. Everybody can have the vitality. And the pain, most of the pain that anybody experiences is all within this abdominal region. And when there's so many surgeries done on a woman, 5 surgeries done on a woman for every one on a man, that we don't have to suffer anymore. We can take the course, the pelvic restoration course. And we're offering it live here in Ixtapa, Mexico at the beautiful Calle del Mar. Such a wonderful setting. And it is from February 2nd to February 4th. And then from February 10th to the 12th is the Zoom Live. And then we're also offering another Zoom Live from March 10th to the 12th. And honor yourself. Allow yourself to connect to the most sacred region and create vibrancy right from the energetics associated with breath work, with meditation, with really connecting to that divine temple of the source energy of a woman and change the world.
That's what Lorraine means. She's done all the reading. You can have all the textbook knowledge of pelvic health. But if you don't have mindful connection within yourself, with your breath, you're not going to heal. You can have all the textbook protocol, but very important to connect within yourself and to bring alignment in yourself with your mind, your heart, and ask for free. It's around us, the environment, absorb everything we can. Once you have all that, you can master that. We teach you how, slowly, day by day, we'll work on it. You'll have lots of time to practice, and you go home with a Zoom video, and you can continue practicing the course at home by yourself, in the privacy in your room. So feel free. There are a few women here now. Are there any questions you guys like to ask about the course? We can answer for you whilst we're still here before Daryl comes back for the class. Is there anything you want to know about the course? Yes?
And something I'd like to mention in regards to Lorraine is that if you go back and you can find it on Daryl Wolf's Facebook, and you can see your testimonial from when you first came. Yeah, your original one. And you see the changes and the vibrancy within Lorraine. It's absolutely amazing. And that's what everybody can do if you decide to take focus. So I love you, girl.
Let Brenda
It's
answer
like
the question.
I'm curious about the hours.
Okay, we say 8:30 to 4:30, but because depending on how many women there are, don't make appointments at 4:30. Because the more we learn, the more we want to learn, the more we want to continue. So we're giving you as much time as you need for these 3 days. So if you have to leave at 4:30, consider yourself, have fun, continue what you're doing, practice at home, go back to your room, come back the next day and start again from where we are. Yes,
That's perfect.
Yeah.
Thank you.
Is there anything else?
Jeanette?
Come. Any questions
you
anyone
go.
has, come forward and ask us.
Come on up, don't be shy.
How does the Zoom live work? Because I'm leaving on the 1st, so
Okay. I've done the Zoom before, and the Zoom is just as good, but let me just give you this. Hi, Lorraine, how are you? The difference is this, the touch. Yeah, the touch. Because you can watch it in Zoom, yeah.
so we're not actually have somebody on a table at home and we're participating? Or
Yeah, nobody at home, only you would be at home doing it by yourself as we instruct you. We will instruct you how to do it, what to do, when to do, and then entirely up to you how you want to do it. So you have free flow at home by yourself.
So this is something that you do on yourself?
Pardon?
This is a technique you use on yourself?
Yes. Everything is you do on yourself. We guide you, we help you, and then when you're in life, I can come around and do some muscle testing on you.
Yes.
But if you're in Zoom, I can't test whether you got the right muscles working or not. You see?
Yes.
So the difference.
Are you doing anything now while we're all here?
Pardon?
Are you doing that here while we're all here?
Yeah. Second
Like-
to the fourth is the course, the live course.
But while we're here for this course, are you going to do any muscle tests? Like, could you be available to do
No,
muscle
it will be
testing?
for people who are in the class.
Only in the course.
Yeah.
Okay.
Yeah, because it's quite private. It's you kind of put yourself in a position where it's very private. It's position and all that. So it's quite important. Any other questions? Okay. So it's 8:30 to 5, I would say, and be prepared to stay on about another half an hour, another 30 minutes. And if you want to continue into a meditation after the class, you can do so. Basically, it's the 3 days. We start off with a Wolf Lancet with a Block of Detox protocol. We have some young, but the 4 pillars, the 12 loving steps, and the perfect day. Make sure you have a consultation done before you come, so it will help you. We have forms for you to fill in about your issues and your problems. We will deal with each issue every day, 1 or 2. We'll pick an issue. We will not name names, just for help with each other. And we will talk about the pelvic dysfunction and functions. The gut brain, we're already covered with Dr. Wolf. And a lot of exercises for your pelvic health, for your pelvic restoration. Quite a lot of it, but they will be slowly introduced bit by bit. I will not push you all out to you one time. I'll introduce them slowly so that you can get used to the different muscles that you're supposed to use, and different positions, different poses. And then we would, of course, teach you self-cultivation, upward draw, breathing, meditation, all that. So you never need to find anyone for any of these things. All that you need to know is within yourself and within your full body physical. That's it. Okay? And I hope you guys will come and join us and have fun with us. Come with an open spirit, open mind, and keep these legs closed for yourself only. Thank you. Enjoy.